It's Facial Plastics Friday. It's Dr. Brace here, and I'm back from Ukraine after getting stuck in Poland. I was there all day Sunday and most of Monday because my flight was late and then the connection got missed. But I got back safely Monday night, and we had a busy week. We had a busy clinic on Tuesday and then surgery Wednesday, Thursday, Friday. Facelifts each day with some rhinoplasties and brow lifts as well. And today I was at Guelph General doing a facelift for a patient that had some higher medical needs and wasn't safe for an out-of-hospital procedure. And while I was there, I heard people asking questions and talking about facelifts, and really drove home to me that people still don't understand what goes into a facelift. Even though I've posted on this many times, but it's a lot more than simply making an incision around the ear and lifting skin. If you do that, then you'll have an old style facelift, a skin lift, which will make you look windswept. You'll have a wide scar and it won't last. And so I wanted to go over today what goes into a face and neck lift, sort of get into the weeds on the surgery steps involved and the structures that are involved, and that it's really beyond just lifting skin. If you look at your submentum, or the area under your chin, most people age in this area not just because of extra skin, that can certainly be part of it, and not just because of a hanging platysma muscle, although that can be part of it. Usually what happens is the fat that is deep to the platysma muscle, the anterior bellies of the digastric, which are deep to the platysma muscle, and the submandibular glands, which are deep to the platysma muscle, all kind of drop and sag with time. And that creates this big fullness, that kind of neck to chin appearance, where you lose that cervical mental angle, you lose that neckline. That happens from those deep structures coming down. And so that's why liposuction or cool sculpting or certain radio frequency devices or Kybella, Belkyra injections alone won't help most people that have an aging neck, because it's really not getting any deeper than the subcutaneous fat. In fact, we love the subcutaneous fat in facelift because it creates a cushion or a barrier between those deeper structures that camouflages it. And if you take away too much of that fat, you'll see all the little ripples in your platysma muscle. It'll look very obvious that something's been done. So the first step in a facelift is making an incision underneath the chin here, lifting up the skin, lifting up the platysma muscle, and contouring those deep structures to create extra space for your skin and platysma to re-contour and re-drape that area to give you a beautiful neckline. Once those deep structures are recontoured and removed, the platysma muscle, these anterior bands, are sewn together. We call it a corset sometimes, corset platysmoplasty, or just a platysmoplasty, and we sew that together from the chin down to your hyoid bone, your wishbone. That creates a sling, that creates a little hammock that now sits at the base of your floor of mouth, at the base of your chin here, and creates a structure that we can then lift from to, again, further refine and define the jawline. Below the hyoid bone, your muscle still comes down and attaches to your collarbones. And so doing a facelift will not get rid of these bands down here. If you flex your neck, you'll still see them because that muscle is still there. But what we do is make a little back cut in that muscle to release that band, release that tension so it's less obvious. So that's step one, is the submentum. Step two would be the deep plane facelift. That's the incision around the hairline, around the ear, and then down the hairline in the back, lifting the skin up all the way to the point where your lateral canthus, or the corner of your eye, connects to your corner of your jaw. So we call that the deep plane entry point, and skin gets elevated to there. At this point, we go underneath the SMAS, and that's that layer that connects your facial muscles to your skin. Under that layer, your facial nerve lives, but it's deep to the SMAS, and it's deep to a layer of fascia that we can respect and keep the nerve safe. Once we lift up that SMAS, there's a ligament right here that has to be released, the zygomatico-cutaneous ligament. And once that's released, then the whole face moves dramatically. And so doing a skin-only lift, doing a sub-SMAS dissection and SMAS lift will get you an improvement, but you'll get a dramatic improvement as soon as you release that ligament. Now you're not pulling against a fixed point with the lift, but you're just repositioning that structure, the SMAS, with its associated fat pads, so the malar fat pads that frame your cheek. When you do that, you get a total reframing of the fat of your face around your eyes, higher cheekbones, sharper jawline, and an improvement in the upper neck. That gets tacked down with sutures, and all that extra skin that we've elevated ends up way over the ear, and you can trim that skin without any tension at all. So that's why a deep plane facelift scar looks so good, because there's no tension on the skin itself. It's all in that deeper structure. So once we've done the submentum and the deep plane, and we've removed the skin and closed everything up. We do the same thing on the other side and lift it up. And that's what goes into a facelift. So it is about a 3.5 to 6 hour surgery, depending on the person, depending on the neck, depending on any ancillary procedures we might be doing, like eyelids and brow and lip lift. And today I did an otoplasty with the facelift. So that's the surgery. That's why prices can vary pretty significantly patient to patient in one office, depending on what you need done, how heavy is the neck, how much contouring do we need, how much time do we need to do that to be able to do it safely and do a good job. And so facelift is not a simple skin lifting procedure. It's an involved procedure involving many structures in the face that are lifted, repositioned, and skin being recontoured so that you have an imperceptible scar when you get to the 1 year mark and everything has faded. If you're thinking about a facelift, we specialize in that here at Guelph Facial Plastics, and I'd love to meet you. We usually find facelift season is in the winter because people are planning events in the summertime, like weddings and other big celebrations, graduations, things like that. And so we're entering facelift season. Contact our office if you want to know more about that. Everybody have a great Thanksgiving weekend.